In this video, we will see the IPD flow of the patient, how the patient goes through the inpatient department. We will see how a doctor issues an admit disposition, how the nurses at the ADT desk are able to view and assign beds, and how the patient is given a discharge disposition, after which the nurses discharge the patient. So on the clinical app, the doctor will search for the patient. Say Mohan Prasad is our patient. The doctor goes to consultation and gives a disposition for this patient to be admitted. Clicks on save. Now at the nurses station, the nurses will log into the inpatient app and they will see the patient queue to admit populated with a patient. They are able to see the general ward and the labor ward and any other ward which is configured for the hospital. They are able to see which beds are assigned to which patients and who gave the admission disposition for this patient, when the patient was admitted, and any other ADT notes which were captured against the patient, and what is the diagnosis of the patient. Now, based on this, they can decide which ward the patient needs to go into, and clicking on this patient queue, they see that they need to admit Mohan Prasad. Click on the patient and then clicking on admit gives us a warning that the patient started a visit as an OPD visit, but now that we are going to admit the patient's visit type will change to IPD visit. Here we can see in which ward how many beds are available and what is the total number of the beds. So clicking on this, we see that these two beds which are highlighted in green are available. Can assign one of the beds to the patient. Now if we go to the patient's dashboard, in this queue now we see that there is a bed icon over the patient's profile, which means the patient is now an IPD patient. And on the patient dashboard, we can see the admission details, which ward the patient is in, and what is the bed number, and the admission date of the patient. Now, similarly, in the visits, we can see that the patient came on 12th of Jan as an OPD patient, but there is a new visit in the patient's name, which is an IPD visit. We can see what are the diagnosis or observations or disposition or any other details which were recorded as part of this visit on the visit dashboard. Similarly, we can click on consultation and issue another disposition for the patient, which will say discharge patient, and click on save. In a similar way, on the nurse's desk, they will be able to see the patient in another patient queue which reads to discharge. Clicking on it, they see that Mohan Prasad needs to be discharged. They will select discharge patient option and click on discharge. Now we see that the bed icon is not there on the patient's profile, and clicking on the patient's profile, we see that the on the admission details display control, we see that the patient is discharged on 12th of January. 2016. And if we see within the visits, it will also say the admission details and any other data which was recorded in this visit for the patient.